Hi, this is Dr. Toby, host of Health and Wellness with Dr. Toby, inviting you to watch our show for this month. It's going to be a great show with Dr. Kimberly and Chad Bibb. Kimberly is a family physician at the University of Mississippi. Chad is a physical therapist in the Jackson area. They both went to school at the University of Mississippi. Kim is an assistant professor, and Chad has his doctorate in physical therapy. And we want to hear their faith journey, their life journey. They've been married 16 years. They have two beautiful daughters, and they are ministers in their church. They help do marriage seminars and health awareness seminars. You don't want to miss it. Kimberly Bibb works with me at the University of Mississippi Medical Center, and she's been an inspiration of a Christian woman, and she's going to share with you what she's learned over the years in courtship, in marriage, in raising two daughters. Chad is a young man, 43 years old, who's going to share his heart on how we can raise a new generation of African American people who can go into the academic world, the spiritual world, and inspire people to change. This is a great show. They're going to share their faith, their focus, their family, their ups and downs, their turmoils. You will be blessed. I'm looking forward to seeing you on the show. Don't forget, Jesus is Lord. God bless you. Hi, you're welcome to Health and Wellness with Dr. Toby. 3 John verse 2 says that I wish above all things that you be in health and prosper as your soul prospers. That's the will of God for you. And today we're talking about how you can stay healthy. We have two distinguished personalities. Dr. Kimberly Bibb and I work together at the University of Mississippi Family Medicine, and she's attending in family medicine. She's a board certified family physician, and she just recently got certified along with myself in American Board of Obesity Medicine. And it's a new field of medicine, and both of us decided to take the plunge, and she was really, really helpful getting me out of my comfort zone to do it. So really grateful. And her husband is a physical therapist in Jackson, Mississippi, and we're going to be talking to them today about health. Last show they talked about their faith journey. We want to see how we can help you and me improve our health. So welcome on the show, Dr. Bibb.
Thank you.
And Chad, real pleasure. Thanks for talking about your family so openly last time. We're going to go into a different set today, talking about health. So the whole obesity medicine epidemic, the reason why we have a board certification in obesity medicine is because today we think about 30 to 40% of Americans are obese. And we think it's going to get worse as we go along in the future. About 60 to 70% are overweight. And unfortunately, a lot of these are in the African American population. And we're trying to see how we can help today on this show, help people watching who have that challenge. What can they do? How can they reduce their weight? How can they stop gaining weight? What is your, from your medical, from your physical therapy standpoint, I want to hear what you guys can offer my client, my patients, my viewers today, because I think a lot of people need to know. I think a lot of people just don't know. I think they will do better if they know better. So that's what I want us to talk about today. How can they do better?
Sure. Well, I'll start with that question. I guess a couple of things that I would definitely recommend, which would be the two main things, would be our diet and our exercise or physical activity. And so I think so much of the obesity that we see today is due to lack of exercise and just not eating a healthy diet. And so that's one of the things that we do a lot of when we're seeing our patients for obesity medicine. And one of the reasons why I got involved with that was because I realized that that was the root cause of a lot of the chronic medical conditions that we see, such as diabetes and hypertension. And so once we can get back to just increasing our physical activity, what the recommended amount is 150 minutes a week. And so even if you do small little things throughout the week, that will add up. And a lot of times patients will say that they don't have a gym membership or it's too hot outside, but just looking for alternative ways to do that, such as doing exercise in the house, doing videos. I actually had a patient the other day who said that his 13-year-old son was working out with his football team, and he started doing some of those same exercises. And so, and that's a way to get your kids involved and get the whole family involved. And so that's what I usually recommend to my patients too, is try to make it a family event and not just solely just that one person, and not really looking at it as something that's temporary, but something that you're going to do long term, and to try to sustain that throughout, you know, your life.
Staying in motion, keep moving.
Right. And then the other part of that again is eating a healthy diet. I think nowadays we have so much processed food and fast foods in our diets, and it's really it's killing us, you know, with a lot of these chronic conditions, a lot of sugar in our diets. And so when we can get back to eating more natural foods, more fruits and vegetables, lean meats, that's what I certainly encourage.
And you know this, every time I talk to a patient about exercise, I have, I mean, I'm not saying it's wrong. What would you tell this person? I have arthritis, my knee hurts, I can't walk more than 3 steps, it's not possible. I mean, Chad, how do you help this kind of people? I mean, when they come to your office and the doctor sends them to the physical therapist and they're hurting, they have pain in the knees and the hips.
Yeah, most of the time there are so many different variables, but I've worked in a couple of different places where home health and outpatient, but the overriding theme is there's something you can do. They might be right, their knees might be so arthritic they don't need to be walking 2 or 3 miles a day or half a mile a day, but there's something you could do, whether it's aquatic therapy, whether it's chair exercises. My grandmother used to, you know, started doing chair exercises as she got older. But there's always something you could do, and you know, usually when presented with a better option, most people will go with that option. Now, there are those who are just going to come up with another excuse. But I've seen people change their entire lives. I worked at a Healthplex, which is like a fitness center, physical therapy. They had pool, they had several things. And there were people that would come in for one reason. Let's try the pool. Well, let's try these recumbent bikes. Well, let's try this class they have. And they might not like the pool, which is probably the best thing, but they'll like the bike. And so usually, you know, 60, 70% of these people, if they're introduced to something, they like it. There's a social component to it. Like you said, doing it with family or friends, and you just keep doing it. That's probably another important thing, not doing it by yourself. Because the people who I can picture in my mind that changed their entire lifestyle after coming to physical therapy, they didn't do it alone. They usually met up with a group of people. You know, it's one of those things where, we're going to meet Monday and Wednesday and Friday and go to the pool, or we're going to meet on Tuesdays and Thursdays and do these chair exercises. So the social component to it probably would be very important. And if you can find something that you like and find somebody to do it with, exercise-wise, then they typically will stick with it.
So we have a problem in the church because it almost looks, and I'm not saying this, I don't know the statistics, but there are almost as many, I'm going to say that conservative, almost as many obese people in the church as in the outside the church. So but maybe we in the church are not communicating the right message. I mean, I came to your church and I spoke at a health seminar, and I was talking about wisdom, investment, and nibbles, you know, what I call the win strategy. And I try to tell people, you know, wisdom means do what God wants you to do. If it's exercise, if it's eating the right portion, if it's living with one woman, if it whatever. Investment means, you know, thinking about the next generation, not just yourself. Then nibble means don't eat the whole plate. Think of take it one bite at a time.
Right.
So what Dr. Kim, you can answer this question. In the church, what can we do to reduce the epidemic of obesity, heart failure, heart disease, diabetes, hypertension? Since we're talking to people who are mostly churchgoers and Christians on the TV, what can our pastors do? What can they do to reduce the epidemic of cholesterol and all that in the church?
Well, one of the things that we have done in our church started several years ago, and I actually went to the pastor with this particular idea as for starting a health and wellness ministry within the church. And so, and I am serving as the president of that particular ministry. And so some of the things that we've done are health fairs where we will have some free screenings where we do blood pressure screenings, blood sugar, even some kidney screenings, because a lot of times we find that a lot of people, even within the church, they don't have a regular doctor that they go to. And so we bring the doctor to them. You know, we do these screenings and we identify what's going on so we can get them to the proper places that they need to go to. But then education is a big part of that. And so we do provide a lot of different educational resources. Many times when it's a particular, such as Heart Health Month or Diabetes Month, then I'll set up a table with information to pass out, or doing mini talks where we can give more information to them, encouraging them to exercise. We've had some health walks around the church. We've brought in people to do food demonstrations. Another thing that we've started, I think last year, was every Sunday we normally have donuts for breakfast, and so
the whole church.
Yeah, in between one of our services in Sunday school, and so we would have donuts and orange juice. So one of the things that we did with the health and wellness ministry, we led a healthy breakfast at least once a month, and we're
Like
Fruits.
Yeah.
right. So instead of having the donuts, we would have fruit, some yogurt, some healthy muffins, water. So just introducing some healthier ideas to them, to where we can hopefully encourage them to lead healthier lifestyles too. And so those are some of the things that we're doing that could also be done. And you mentioned pastors. Again, I've talked with our pastor about that being an important message to send from the top, from the leadership of the church. And so I think a lot of times when we have the pastors and the leaders sending those messages and encouraging people to do those things as well, it makes it even more important for people to follow along. So those are some things.
I heard of First Baptist Jackson. They have a gym.
Yeah,
in
they
the
do
church.
have a gym. Yep.
I'm like, wow, that must be an investment.
Right.
Number
Yeah.
one, because
Right.
not every church can afford to equip a gym. I mean, I don't think it's that expensive.
Right.
But if you have 500 members, I mean, you're going to have a lot of machines running, right?
Yeah, and we've done some exercise classes in our church. Even Chad mentioned the chair exercises. We've had classes where the seniors have come down and done some chair exercise classes. And so we tried, throughout the year. It may not be on a consistent basis, but trying to do some things throughout the year to educate and do some.
And most churches have like basketball courts, something.
Yep.
Something outside of
Yeah.
a portable hoop or something.
Right.
So I hope we're using it. I mean, I'm sure the kids are, but maybe the adults are not.
You were mentioning when you came to our church, I was just thinking like even that's something new that we do, where it's like, let's get a doctor in. We've had a psychiatrist come talk. We've had other people come talk, but that's something new in the last 4 or 5 years. 10 or 15 years ago, we weren't doing this talk. So I think, maybe not all churches, but churches are changing the narrative.
Right.
I know our church is. Even our pastor, when he's preaching, he's talked about how he had to change his whole entire lifestyle. So treating our body as the temple. I was just, like I said, the fact that we had you last year, and that's probably been going on for the last 4 or 5 years, bringing different doctors in, and the health and wellness ministry having health fairs and different things. We're trying to change that narrative, where it's not, let's eat some, we got fried foods and greens and everything. That's what we're going to eat between service and all that kind of stuff. So hopefully the narrative is changing.
Yeah, because people know the church more for eating fried chicken and sweet tea. And I mean, that's what people know about the church. That, you want to get fried chicken, go to the church. Sweet tea, go to the church. And we know those are not healthy options.
Right.
So I don't know how the church got identified with the unhealthy food.
Yeah.
Was it the church mothers? Or,
Right. It tastes so good.
or was it a way of bringing people into church? I don't know. So
It's probably a combination of the two. That fellowship. On a warm summer day out under the shade, and they're just having a good time. I'm sure that's how it kind of stemmed from, fellowship time. But that.
So what would you do as a physical therapist if your pastor says, "Hey, Chad, do something to the church for the church. Let's inspire exercise." What would you craft out if you were to put an initiative forward for the pastor?
Personally, if it was me, I'd probably get somebody else to do it. But as a physical therapist, we have this one dynamic to it as far as chronic pain and acute injuries where you broke something or you tore a ligament. But transferring that to the church, we have members who are, it's not even their job, they work out on a regular basis, and they like having classes. So if it was me, I would take a group of those people and say, hey, let's every Monday or every once a week, let's have something here at the church. Kind of like you said, First Baptist has a gym. If it was up to me, I would kind of bring them into the fold. Now I would help any way I could, from a physical therapist standpoint, but actual like athletic trainer people who work out people and who like, I got little cousins that do classes and they like having people come out. They like to see people lose weight. Maybe if you had somebody at the church that could do that once or twice a week, and the church might supplement the person who's doing it, that kind of thing, where you put your treasure is your heart, put some money behind it. That's probably the direction I would go, because again, if you go to things like that, and the cousin I'm talking about, he does it at various places. If he'll do a phone video of what's going on, and everybody's laughing and moving and having a good time. It's like 10 or 15 ladies out there exercising, and that's the kind of things that keeps you coming back. But if I go outside and say I'm gonna go run 3 miles, I probably won't do that more than a couple of times. So
Now, when I think of your family, Chad, your sister, I heard, played basketball for Mississippi College. Now, you were athletic.
Well, that's debatable, but since my sister's not here to count, I played basketball in high school.
Okay.
They would be watching this saying differently, but we all played. My little sister played softball and basketball. I played basketball. We were all active and played sports. I can remember growing up, my dad, played on one of those, I don't know if it was a church softball or a community softball team, and we would just go to community on Sundays and Saturdays, and we'd play softball, and we'd be,
Because
cheering them
today
on.
the kids are playing,
Oh, yeah.
what was that, Wi-Fi,
Any kind of PlayStation.
Yeah, PlayStation.
Yeah.
A lot of kids don't go out
Right.
and play.
Right. We make our daughters play sports. I mean, they get to pick later on what they want to do. Now, don't get me wrong. My oldest is, she's on Fortnite all the time. We have
What's
to make
Fortnite?
her. Okay, but never mind. You.
I have no idea.
He hadn't learned
Oh,
it
it's a
yet.
video game.
Yeah.
Okay.
But again, like the other day, I told her, let's go hit some softballs. I said, don't you want to play softball? So yeah, you kind of have to encourage this generation to kind of get off the couch and keep moving, kind of thing.
So I think the church needs to step it up, because if we don't start speaking to the youth, bring them out, tell them go out, play outside, they'll be so happy just sitting in the house, watching TV, playing on their video games. I heard YouTube is actually a big deal with them. They can sit for hours watching YouTube.
You got a lot to learn.
Yes, our youngest, she can do that for hours if we let her. So we do have to set some limits.
And medically, they tell us you should not watch any screen time, whether it's phone or TV. If you're less than 2 years, 0. If you're 2 years, maybe I think to 5 or 6, 1 hour. And maybe I think from 6 or so,
Like
2 hours maximum. That's what the American Academy of. And today we have kids watching, average in America is 4 hours.
Right.
So what do you plan to do in terms of your kids as they grow up? How do you intend to restrict their screen time? Do you have, some people have this thing they can monitor what their kids are watching, or they can, I don't know if you can shut their phone down from afar.
Yeah,
I don't know what
I mean, that's pretty much what we do today, is we have to set limits. And then, as Chad mentioned, we get them out and do some type of physical activity.
So you play with them?
They both are in softball. They both play softball. And so even when it's not softball season, even when they're, at the grandparents', they're outside doing some type of, running around, playing on the trampoline. So we try to keep them active, try to even have them to do other things such as reading or...
But it is a fight, though. I'm not going to... Because what happens, you work all day, and you just want a little bit of a break. And so if the 8-year-old has the iPad over there watching one of her YouTube shows, it's real easy to say, oh man, I'm gonna close my eyes for a minute while she's on there. But sometimes you have to just kind of buck up and say, all right, let's go, girls, let's do something else. So I could, not being judgmental of anybody, because I know for myself, when you're in church and one of them getting a little anxious, it's here, take the phone, that kind of thing. So, but we do have to keep in mind how much screen time they have, even if it allows us to get a couple hours of sleep.
And then going to places helps, doesn't it?
Oh, yeah.
Like going to Disney or going to the zoo or going to the park.
Right.
I mean, those help.
Oh, yeah.
Get them out of
Right.
the house, do some family activities
Right.
together,
Right.
picnics. Those are things that I think that we can encourage.
Right. Yeah.
Just that family time. But like you said, with the way families work today, it's difficult. It's not easy. Yeah. It's a tough call. So God said in his word that with long life I will satisfy you. That's Psalm 91 verse 16. The will of God is that you live at least 70 years according to Psalm 90. Okay, so the average life expectancy in America is 78 for women, 78 for men, 79, 80 for women. How can we help the American church increase their life expectancy? I mean, from your own perspective, what can we do educating? You may be talking to a 50, 60-year-old and, they have some medical condition. What can we do as doctors, as physical therapists to increase life expectancy amongst the average churchgoer in America?
I think a lot of the stuff we've already talked about would go a long way, where as far as diet or finding something you really like to do. But as you were saying that you use the age group 50 or 60, one thing that we would have to kind of promote as a physical therapist, I started doing home health therapy about 4 or 5 months ago, is that it's not too late. You know what I mean? Doing home health, you meet some chronically ill people that can't get out of their homes. Home health has two different types of people. There are people who had a traumatic injury. They might have been healthy. They just had a traumatic injury, and you go into their homes until they get better. Then there are some that have chronic things going on, lung cancer because I smoked or whatever. But what I'm seeing in home health is it's never too late. It's never too late to stop smoking and start walking around the block. And it's just amazing to see them months later, and they feel so much better. They're not tip top, 100% because of the things they've done to their bodies over the years, but they will tell you, I feel so much better. I went to a lady yesterday. She said, my knees feel so much better now that y'all showed me those exercises to do. And it was as simple as sitting on the side, up and down, but it was because she's just been sitting in her recliner watching TV.
Your dad is how old?
Oh, was he 70? I think.
And your mom is?
Oh, I want her 55. No, no.
Well, anyway,
We don't know.
But at least they've hit that golden age of the Bible, that's 70 years. So,
Right,
and
right,
your
right.
parents are
About the same age.
same age.
And they're all healthy. They've done well from a chronic thing
Right.
kind of standpoint. Now, of course, you have orthopedic issues. that
But
come to
looking
life.
back, they didn't smoke.
Oh, no.
They didn't drink.
No.
So I'm trying to put it across to
I got you.
people that those are things that are positive.
Oh, yeah.
Right.
There's some
Yeah.
things that we need to do, but there's some things that we don't even need to do.
Right.
That
Yeah.
if we don't do, may even increase our years on earth.
Yeah,
Right,
and I'm
right.
glad
You
you
know.
said that. That's easy. And then people sometimes feel like you're trying to be judgmental, but you're not. It's just it's not good for you. You know what I mean? It's
Right.
not good for you. Smoking is not good for you. Drinking is not good for your liver, and all those fried foods are not good for you. So it's just and it's not good for you.
How's your dad's health? Is he doing
my
okay?
dad, yeah, my dad
He's
is.
a-
But I see your mom. She's
Uh-huh.
pretty
Right.
up and going. I haven't
Yeah,
met your dad.
Oh yeah, well he is probably one of the healthiest
Really?
men of
He
his
has a
age.
farm.
I
He
know
has
he's always
animals to take care of.
outside and.
So what's the
mean,
secret? How did he?
Well, again, I
Stay
think
this
as
healthy.
you mentioned, just staying physically active, and then not doing some of those things such as smoking and alcohol abuse, and he's just really taking
And eating non-processed, natural,
right, just
green
eating
from the
more,
farm.
Yeah.
Wow.
Even I think I mentioned to you before, but they actually have a garden or farm now where they grow a lot of their own vegetables and
Okay.
then cook those. And so trying to do that within my own family too is just something I'm hoping I can kind of take on. But I think some of those things are, and then too, just enjoying life and just trying to minimize like the stress. I think a lot of the stress that people have these days really takes a toll on their bodies, physically and mentally, and just how to manage that stress or minimize it as much as possible. And even some of the, anxiety and depression that we see, it really affects people, and just knowing when to get help for that, and not being afraid to ask for help. And so I think that plays a big role.
So working for Jackson City didn't cause any stress?
Well, I won't say, but I
those
think,
days, maybe it did.
it definitely, but I think the way you deal with that and manage it, and not let that, not internalize a lot of that, and not let it affect you, and not let it affect your family. I mean, we heard about a lot of the things that were going on, but my father didn't, let that, take a toll on him and let it negatively impact him. He really was, I think, an inspiration for me and my sister in terms of how to manage and deal with people, and and talk to people, and not get stressed out by things, and knowing when to take breaks, and taking time out for yourself, and not getting too stressed out. I mean, even today when I call him, if I'm studying for the test that we were studying for, or working hard, doing notes, he'll always say, well, you need to take a break, know when to take a break. So knowing how to get your rest, and relax, whatever that means for you. For him it's working on a farm, but for me and Chad it may be going on a trip, and so finding what makes you happy and enjoying life.
So in 1 minute, I want to talk about the obesity medicine. If somebody comes to your clinic and you're the obesity medicine specialist, what do they expect?
So a lot of times they think that they're coming just for one thing, and that's medication. But I tell them we look at the whole person. I look at their chronic conditions, look at their psychiatric conditions, and we treat the whole person. We focus on their nutrition, focus on their physical activity, any mental health that we need to focus on, and we make those necessary referrals. And if medication is a possible option for them, then that may be something as well. But again, I tell them we're wanting to look at and treat the whole person, and try to help all of their chronic medical conditions, and get them to a healthier way of living, not only for themselves but for their family members as well.
Awesome. So we're going to come back next show. They're going to tell us how they got to where they are. They've had their own ups and downs. They've had their own turntable events and things that have upset their apple cart and plans, but we want to learn from what they've experienced so that you don't have to make that same mistake in your journey. So you don't want to miss our next show with Chad and Kimberly Bibb. They're going to be pouring out their heart, their faith journey, their medical journey, their academic journey, how they got to where they are, how God kept them as a couple, as a family, and brought them to the point where they are. In the month of June, we're having a special mid-year Holy Ghost night. We're doing a Holy Ghost night with Dr. Ferdinand Weke from Nigeria, June 28th, Friday, 11 p.m., Clarion Inn. You don't want to miss it. It's a Friday night, 11 p.m. to 4 a.m. The theme is Kata Lambano, the light that shatters darkness. Looking forward to seeing you there. God bless you. Jesus is Lord. Amen.